Nicole Lamberson, welcome to the podcast.
Oh, thanks, Dr. Leeds. Glad to be here.
So, yeah, so how are you doing? I see when you came up on you came up here on the on Zoom as Medicating Normal, which was a great film.
Oh,
Um,
yeah.
yeah,
Sorry.
how are things going with that?
Yeah, I still work for the film. I use the Zoom. It just automatically logs me in because we do so much Zooming with people. But yeah, we're still in distribution, trying to get the film shown. We did a huge screening in Virginia Beach that had CME that was offered by the local medical school, and there were between 500 and 800 people there who attended, and it was a really, really great event. Bob Whitaker came down, Sammy Tamimi, child psychiatrist from the UK. So yeah, we're still trying to show the film, all over to people who need to see it.
Yeah, it was a great film. I mean, it is a great film. I enjoyed watching it. I learned a lot, and every doctor should watch that. That should be required watching, because I think a lot of people don't realize things have changed in the last couple of years. A lot of doctors are still going on what they learned decades ago, and we used to think benzodiazepines and even some of the psych drugs, the other ones, were very safe. We were kind of, when I learned about things like Prozac, Paxil, Zoloft, Lexapro, all the SSRIs, they kind of felt like antidepressants with training wheels on, for like the primary care doctors, so we didn't have to worry about all the dangers of mixing them with things and adverse reactions of the older drugs. So they kind of just seem like really easy, like, oh yeah, here's your Prozac, you'll feel better. Here's your, Xanax and Valium, all the benzos. I always used to think they're like super safe. I'm like, oh, if only like people like Jimi Hendrix had taken a Valium instead of whatever he took, maybe he'd be alive today. And they don't kill people. But now we know just in the last couple of years, like the last 3 years, maybe they changed the labeling, and now we know these things are toxic to the brain. They cause real brain damage and suffering for people.
Yeah, and it's funny you say that because well that you arrived at the same place with the antidepressant stuff as well. There's physicians that I encounter in the activism space for benzodiazepines who still say in their presentations that SSRIs are a great first line alternative to benzodiazepines. And then they just like leave it at that with no informed consent, no like asterisk, hey, by the way, these things can also cause physical dependence and severe withdrawal syndromes that can be protracted. And there's whole communities of people, just the same as with benzodiazepines, that are suffering horribly trying to discontinue their SSRIs and SNRIs and antidepressants. So it's like some people, I've noticed some physicians and medical providers are like willing to go as far as the benzodiazepines, but they sort of stop there as far as their knowledge or I don't know, willingness to accept that there's problems with the other classes as well. Have you seen that?
Yeah, yeah, definitely. And you know, it's difficult because there's so many of these things out there, and that we've and as we talked about before, the pharmaceutical industry is so entrenched in medical education. That's where we learn a lot of what we know from, and it might be difficult to even see how far their reach goes. Medical school, I remember this one professor said, "We will not use any brand names for any drugs in my class." It was a pharmacology class. He said, "We'll use generics for everything." But I still think that their reach goes all the way through to medical school, to definitely in postgraduate education and residency, and then once doctors are practicing, they get a huge amount of their education from a lot of the conventions. I don't know if they still are, but I think they are. They're sponsored by these drug companies. That's who's paying for them. In fact, one of the really good ones, Primed, I don't know that it's good. They have some great keynote speakers, and it's a huge, big event, and it's put on by Harvard University. But it's free. It's either free or low cost. I've been invited to it free, and I think it's hugely subsidized by drug companies. They have like these incredible pavilions, and the really nice ones, like on the big open floor, like where you go to look at the different drug companies. And I'm sure you've probably seen these kind of things. That some of them have really plush carpet, and you can tell there's memory foam under them, and they're giving you free gifts and
Yeah.
promoting whatever drug. And maybe some of these drugs are good and useful, but like you said, informed consent. If you look at the list of side effects and adverse reactions, and I think doctors sometimes read through, they look at it quickly, they're like, wow, that's a lot of small print. Let me just go with what the drug rep said, that we've never seen any of these problems and it's pretty safe. But we all really need to read that whole list and take it all in.
Yeah. And just, I mean, I think it was Peter Gocha who said, well, and one of the clinical pharmacologists out in Canada, Dr. Jim Wright, that I'm a huge fan of, basically said, like we should take like no medications. That should be our goal, and that, or as little as possible. Like really only use medications when you absolutely have to, and you've like weighed all other options and you've tried other things that are safer. They should be our last resort. But I think our societal type thinking now is like, oh, there's just something for everything. We just run to the doctor and expect a pill. I know. I mean, that's how I wound up in the mess that I wound up in. So I think we need to like really reframe our thinking. And I talked to a friend the other day in Europe. He's a survivor of psychiatric medications. And he said they're really moving towards social prescribing. Like, you come in and you're having something difficult and it's like, well, let's talk about like what your friendships are like, or maybe you need to plan, a dinner out with your closest buddies, or you need to start, exercising more, and those types of things, which you never hear about when you go out seeking support from your physician for these things that are just part of the human condition, really.
Yeah.
Yeah.
Yeah. And that's one thing I've been looking at recently and trying to do some podcast episodes on are therapies where there's not really any downside. There's no medication or drug or risk, relatively. One of them was aromatherapy. I had no idea how deep that went of the capabilities and the richness of what can be done, and it's really, and it's not, and somebody might hear, oh, aromatherapy, smells, yeah, that's great, but it's a real thing, and if it's done properly by someone with the right training, it can have a real effect, a lasting effect, and a really beneficial effect. And then there's one I just did was dance movement therapy, and that just seemed incredible. Just the idea of like helping people to move and get trauma out, and relieve stored trauma, and to connect with their spirituality. And this is a therapy that has there's no drug involved. There's no risk. I mean, other than you could like bump into someone by accident moving around, but that doesn't really happen. But yeah, I mean, it's incredible that there's actually good therapies. There's sound therapy, binaural beat therapy, which can really help a person. It's proven to help people with anxiety and relaxation. But yeah, sometimes I feel like when I talk to a patient or I do a consultation and I bring up those kinds of therapy, even with people who are iatrogenically injured by benzodiazepines, I think there's still a reflexive response to go to the drug therapy. Like, what's something I can take? Yeah, I know. Yeah, sound therapy, movement therapy. Go outside and walk and get some sunlight, in your eyes and whatever, and take a walk in the fresh air. That all sounds great, but prescribe me something or recommend a supplement. I'm like, well, but those things are real. They really do help.
Yeah, it's true. I mean, I say all the time, like, if I would have done all the stuff that I was forced to do to survive psychiatric drug withdrawal, before I took medication, I probably wouldn't have needed it. Like, I used to play softball when I was in school, and basketball, and then, you get out of school and you start a career and life gets busy and you sort of get away from those kinds of things. And I feel like if I would have been more in tune with, exercise and walking and taking better care of my body and that kind of stuff, like yoga, I started doing in psych drug withdrawal, and nothing crazy, like I'm not in these like intense poses. Yoga can get pretty intense, just the relaxation type, yin or restorative. It really, I mean, even in florid benzo withdrawal could put me to sleep in some instances. I could get myself to a place of that much relaxation. And going for long walks once I was strong enough in my withdrawal really does give you some kind of like good mood chemical when you're doing it. And after I notice just being outside and how much better I feel in the process and when I get home. So they do work. Yeah.
Yeah, definitely. and it's true though that it's there is this thing in the medical field of they at a certain age they expect people to be on medications. It's like a normal thing, and these even I'm thinking of cholesterol medication, the statins. They for a while they were pushing them as saying we should all be on them. That should be like everyone should take an aspirin, um, Lipitor or something similar, and just to protect us all from like this stroke that might happen or whatever. And I went for my first colonoscopy like I think last year, and they were kind of surprised. They're like, "Well, what medications do you take?" I'm like, "Well, I don't take anything." Well,
Yeah.
what do you mean you don't take anything? How are you like 53 and not taking any medications? I'm like, I mean, really, it's partly because I'm not a good patient. Like I'm just not good at taking things. Like I'll just forget if and like I actually did try taking cholesterol medication every day, thinking it's going to keep me protect me from stuff happening, and I just couldn't keep up with it, which I guess is maybe a good thing to have, to not be a
Yeah.
good medication taker. But
Yeah, well, there's some bad stuff out in the, about those statins and stuff too. But
yeah,
yeah, I get the same thing. I go to the doctor now because I was injured by psychiatric drugs. Like I've seen behind the curtain. I'm very, cautious about what I put into my body. And the nurses, when they're checking you in, are like, "So what are your drugs?" And you have nothing. And they're like, "Nothing?" They're like so shocked,
yeah,
because it's just not the norm. Yeah.
yeah, definitely. Um, Now, so that being said, I mean, there are some supplements, for people in protracted withdrawal. Hopefully, there's some medications and supplements that might help some people. And I know that it's very difficult, like that, that anybody can. I think when someone's in protracted withdrawal, anyone can react to anything. There's no two cases that are the same. And something that worked for three, four, five people in a row, and you're like, wow, I finally found something. This one's really going to help everybody. And then the next person has a reaction to it, and it's like, well, okay, back to the drawing board. I thought I had this figured out, and there's just no definite one size fits all. And especially when you recommend a medication or a supplement. Um, and I think we're all trying to push forward and find new things. There's some things that I think might help, and there's some things other people think could help, but there just hasn't been the research yet, and nobody wants to be the guinea pig, and try something that may or may not work. Now, you had mentioned before we started phenergan. Can you tell me more about how that might be helpful?
Yeah, so I just stumbled upon it, kind of accidentally because I had like a year ago severe food poisoning, and being in psychiatric drug withdrawal, benzo withdrawal is bad enough. Add food poisoning on top, and it just pushed me to the point where I was like, I literally want to die. Like I can't take all of this at once. So I got a prescription for phenergan. And like I said, I'm not somebody who takes things easily, but that was like a moment of desperation. And I got the 12.5 milligram dose, which is the smallest, because that's another thing I've learned along this journey is a lot of times we'll start people on doses that are way too high. You can sometimes take half of what the recommended dose is and still have a really good response from it. So I took 12.5 milligrams that time, and it did help a lot with the nausea, but I noticed that it calmed me down quite a bit and that I could sleep and I felt relaxed. So I was like, okay, well, I didn't think much more about it though, because it really in my mind, I was framing it around just this nausea event or whatever. And I still had the bottle of Phenergan a year later. And last week I got norovirus, which, if anyone's had that, my goodness, I'm so sorry. It's awful. But it was sort of the same situation, just sort of driven to the brink of panic and like, I can't feel this way anymore. So this time I took half, so half of the 12 and a half. And it was the same. I calmed down. I felt less panic. I was able to sleep. And one adverse effect I did notice because of my withdrawal, I'm very prone to like DPDR, dissociation, cognitive fog. So it did worsen that a bit, but just for a short window of time, and then it faded off. But anyways, long story short, so then I keep in touch with a lot of psychiatrists and stuff in this critical psychiatry space who are seeing patients in withdrawal on a regular basis. And I just text one of them and said, hey, just thinking out loud, but like this Phenergan pretty much helped. And he wrote back and said, yeah, me and my my psychiatrist partner that I work with, like it's becoming our number one used drug for psychiatric type symptoms. We obviously they don't use it long term, just sort of a short term rescue medication because he did say it can cause physical dependence and withdrawal. So that was just interesting to me. Like maybe this is like another little tool in the toolbox for people in like a severe state if you just need a break or something.
Yeah.
Not to say it does have, you know, a list of side effects and things that it can cause that are pretty scary, like the extrapyramidal stuff. And I don't know how common that is, or if you have to be taking it kind of longer term for that to happen. You might know more about that.
Yeah, I'm not sure about how serious the risk would be of that, but it is interesting. And did you get it as a liquid, like the cough syrup form of it, or a tablet or capsule?
Tablet. Yeah, I had the
Okay.
tablet. Yeah.
Okay.
So
But yeah, anything that's available as a liquid, that makes it possible to take very small dosages. You can measure it out with an oral syringe, and it can be taken in a fraction of like the regular dosage. So that's good.
yeah. Well, and I also talked to another friend after that who's in the withdrawal support community, and she has autism. So she's kind of prone to these events of being upset. But she's also in withdrawal too. And she lives over in Europe. And she said, oh, that's whenever I was in crisis, that's what they would send me home with, was phenergan. So I just had no idea it was used for psychiatric type stuff. So, and it was just kind of coincidence that I took it for nausea, and I'm like, this kind of worked, in the moment,
Oh.
anyways.
So
Yeah.
what what did it relieve as far as like the protracted withdrawal symptoms? Like what did it help with?
Yeah, so I didn't feel like normal. Obviously, it didn't like reverse the withdrawal or anything and
Yeah.
make me feel like, oh, I'm healed. It was more of just like a cover, sort of. So sedation, sleep, some panic relief, anxiety relief, just like a calm, feeling of like I got a break from it for a little bit, if that makes sense.
Oh, okay. Yeah, that sounds, I mean, it's definitely good to know. I mean,
Yeah.
the more tools we can put in this big empty toolbox that we have, the better.
Yeah.
Um,
I mean, you do feel like you are kind of drugged, and it's a sedative. It makes you feel like that. So it's not like you feel great, like you're alert and awake and you're healed and all of that. It does have this sedative type sensation, but when you're in severe panic or anxiety and just fight or flight, like that's kind of welcomed sometimes when you just need an emergency break from it or something. So
yeah, and I think I might have mentioned to you we tried with a patient who was in pretty bad protracted withdrawal, who had stopped benzos a long time ago, almost a year up to that point, and was still suffering with really severe symptoms. And part of it was described as pain. A lot of people will describe pain, but not in any specific area, just kind of like an inner pain that's hard to describe. And when she went to the ER and said this pain is unbearable, and it seemed inhumane, they wouldn't do anything for the pain. So we tried a very low dose of buprenorphine, which is an opioid that we use for treating opioid use disorder or dependence, and very, very low dose. And she actually had what seemed like kind of a reprieve from the withdrawal, almost like for half a day it was complete, like she was back to normal, like um, making herself a sandwich or something and walking around smiling, almost completely back to normal.
wow.
But that was just one. The next day, she seemed to have developed like a tolerance where there was just no way to get that effect back.
Yeah.
Um, and then she did see a pain management doctor that put her on a higher dosage, and it just never came back again. It was like a one-time thing. So, we thought we had discovered something, and then again back to the drawing board. That's not really going to be a long-term solution. Plus, I mean, if someone were to take buprenorphine long-term, beyond like a few weeks, that's another dependence that they'll develop.
Yeah.
So,
That's the problem, isn't it? Like, I mean, maybe some people are suffering so bad they don't care that,
yeah.
they'll take something every day just because it's that bad. And you can't fault them for that. Like everybody has a different level of what they can tolerate. But for me, that was the scary thing. Like I suffered all this time and embarked on this journey to get off of drugs. The last thing I want to do is get myself physically dependent on something else again. And
Yeah.
I think from what I've noticed in my observations, just anecdotally with people going through withdrawal syndromes from benzos and antidepressants and other psychiatric medications, is like sort of the kindling concept seems to apply to other drugs too. It's almost like once you've pissed off the nervous system and put it into this withdrawal, if you become physically dependent on something else, it's like that's hard to get off of, or that kind of starts up the withdrawal syndrome again, like each time you try to come off of something else. And so for me, it was just this fear of like, well, I might feel better in the moment, and then I'm physically dependent on this new thing. But what happens when I try to go taper that, even if I do it slowly? It could be excruciating. It could kick up my withdrawal again, and then I'm back at square one.
Yeah, that's a good point. Like it's easy for a doctor to think, well, opioid dependence and withdrawal is bad, but not nearly as bad as benzo withdrawal and tapering. But a person who's already been through that and protracted withdrawal from benzos might have a worse experience tapering off of opioids. So it really, you're right. It wouldn't be a good idea to allow someone to become dependent on something else, if at all possible, to avoid it.
Yeah. I think just if people can get away with, reprieve, just sort of like bursts, if you have to take something, and just sort of spare your nervous system becoming physically dependent on something, it's ideal. But like you said, everybody's different. And a phenergan for me may have worked in a rescue situation like that to make me feel some relief, and somebody else may have a horrible response to it. So that's part of the tricky part of all of this.
Yeah. Did you ever have issues with histamine sensitivity?
Not that I know of, but I mean, I don't know that I ever really paid attention to sort of, I hear people say that in the withdrawal community all the time, like, oh, I'm having histamine sensitivity, or they're eating a low histamine diet and that kind of thing. But I don't know how
Yeah.
they like determine that or sort of narrow it down to
I, I've
histamine. Yeah.
I've seen a couple of really severe cases of it, and sometimes it can manifest as intestinal discomfort, which could be, I think maybe the benzo belly thing could be related to the histamine intolerance, or at least some people who think they have benzo belly might have histamine intolerance. But I've seen some really clear-cut cases of it where a person develops a really severe allergic reaction. And early on, I thought it is maybe it is an allergy to environmental things, and I recommend like an air filter and cleaning the pillows and special pillowcases and all these things for environmental allergies. Keeping the pets out of the room, which isn't always a good thing because animals, a dog or a cat might be really comforting, and now you tell the person that don't let the animal in your room anymore.
Yeah.
And it turned out that working with people further, that when they have this histamine intolerance, it is really food related, and some foods contain histamine, some I guess will stimulate the release of histamine, and and then the treatment seems to me, there's a variety of things that might help, because you can't really avoid all these foods because it covers almost everything healthy and everything that people want to eat, but they can avoid them as much as possible, and then there's like the enzyme DAO that can help, and
Mhm.
probiotics, and and that's come up with patients. And recently, someone I spoke with, they were questioning the probiotic. They're like, well, aren't there certain probiotics that people in protracted withdrawal shouldn't take? And there can be sensitivity even to the DAO enzyme if you take too much of it or the wrong one. So it's really tricky. But the histamine thing is definitely real, and it's something to consider.
Yeah. I mean, for a long time, I was so messed up that it was like, I mean, everything was wrong. So it was like, oh, is this from this or my food? Or like, if I would
Yeah.
eat, I would feel instantly worse. Like all my symptoms went crazy in the beginning, just from any kind of food. It didn't matter. Um, and then like smells and cleaning products and that kind of stuff. And I found it interesting. I interviewed a guy that specializes in neurotoxicity from all kinds of agents, not just medications, but mold and anything essentially in the environment that you could become neurotoxic from exposure. And he said it doesn't matter the agent, essentially, that everyone he encounters, or not everyone, but many people that he encounters with neurotoxicity and he would formally diagnose with neurotoxicity, has this presentation of sensitivity to all kinds of things that they were never bothered by before, smells and chemicals and soaps and foods and that kind of thing. He said it's very common presentation.
Oh, well, that's interesting. That might be something to look into further. The people that have been injured, that have had brain injury from other kinds of toxic exposures, and see how they're being treated and what works for them.
Yeah.
Um, but yeah, that's definitely really interesting.
Yeah. I will say the longer I'm away from the drugs, like as I'm further out into protracted, I feel like I'm tolerating stuff better than I did in the worst years of it. So it's like it almost fades, or you start to like, foods don't really do that to me anymore. I'm much less sensitive, I think, and I can take, like, I've taken antibiotics and stuff like that without having any reactions, knock on wood, where in the very beginning I would have been having a much harder time. So
Yeah. Did you ever have akathisia at any point?
oh yeah. That's why I reinstated a benzo initially. I was cold turkeyed in a detox center from two benzos, a Z drug, and then I was also on Remeron, Seroquel, and Adderall. So all six of those at the same time when I checked into the detox center. And of course, they only rip you off of the ones that they deem addictive. Uh, they leave you on the others, and then they start adding new stuff like that they don't think is a problem, even though it causes physical dependence and withdrawal just the same. They try to put you on SSRIs or things like that. But yeah, I had severe akathisia after that detox. I mean, I paced until my feet bled and was hysterical with suffering. And so I lasted 4 months. I had a suicide attempt because I just could not go on in that state anymore. And then I found a psychiatrist who put me back on benzodiazepines for like an 18-month titration off of them. And it did sort of stop the akathisia enough where I could live with the way that I felt, and hang on. So, yeah.
Yeah. Well, and how long did the akathisia last again?
I mean, the severe stuff where I was like pacing and begging to go to the hospital every day was 4 months until
Oh,
I went back on the
oh, okay. And
benzodiazepine.
and
Yeah.
you didn't have it again after you reinstated and tapered gradually.
I did, like, at a low level, if that makes sense. Like I felt like it was always kind of just under the surface. So,
Yeah.
but it wasn't like when I had it before I reinstated, it was just front and center. I mean, all I did was pace and scream and beg for help. Once I was tapering and off, it was like it was sort of like living inside of me, but it was like it was just there. And the only way it would come out is if I was like made to be super stressed or like super panicked or something. Then it would come back and I would feel that same like type of
Yeah.
feeling. But if I was calm, it wasn't a problem.
Do
Yeah.
you think and I know some people that go through this, they become activists in the field of like really being angry about what happened to them, and angry at the doctors and the hospitals, and maybe being tapered too quickly, taken off cold turkey.
Yeah.
And no matter how bad the suffering is, they'll say, never again will I touch a benzo. Will I take another one? If a doctor even says the word, they're evil, I don't even want to hear the word. But do you think that maybe there's people that should consider reinstating and doing a very, very gradual taper if they're really suffering?
Oh, yeah. I mean, if I would have known at the time of my detox what I know now, I would have reinstated immediately. And I would have reinstated to the same dose that I had been ripped off of. I think one of the biggest mistakes I made is that I uh, well, I didn't know what the hell to do. I wasn't as educated as I am now. And so I let my doctor put me back on, like, I think it was like 1/8 or 1/4 of what I came off of. And that doesn't work. I mean, your brain remembers what you were taking, just
Yeah.
before. So if it were that easy, why would somebody do like a 3-year taper from 20 milligrams of something if they could just lop it off and then only reinstate 5 milligrams and have a much shorter taper? You know what I mean? Like you
Yeah.
have to sort of give it back at least, close to what you were on to begin with in order to stabilize and get full symptom relief. So, yeah, I think there are people who there's this sort of, like tough man stuff that goes on in the withdrawal support group sometimes, like just stick it out, you'll heal, everybody heals. And we set people up for protracted syndromes and severe suffering way more than I think some people have to be. And they could have gone back on, got stable, and had a pretty good taper. That said, there are people who, for whatever reason, I don't know if you just rock the nervous system so hard when you cold turkey that they try to go back on and it either doesn't work fully, they just get like partial relief, or sometimes they reinstate and they feel worse.
Yeah.
But that seems to be like the rare type of, report. Most people can go back on and feel better, at least mostly better, and taper, and they should do it as quickly as possible after making a huge dose reduction or cold turkeying so that they can not sit in a bad withdrawal state for a long period of time and damage the nervous system.
Yeah.
Yeah.
Yeah. One thing I've been thinking about is, when 9/11 happened, they're looking into all these different things that happened. And one thing that they found highly suspicious after the fact was how these guys trained to fly planes, but not to land. They're like, well, we don't want to learn about how to land a plane. We just want to learn how to take off and fly. Landing's not really important to us. And that seems crazy. And I was like, how did they not report that? Had that not be that should have been a big, huge red flag. Yet
Yeah.
in the medical, the entire medical industry, the healthcare industry, maybe that should be a big giant red flag that doctors are not taught how to land the plane, how to get people off the medication, how to taper gradually, what needs to be tapered. Um, Pharmaceutical companies don't teach doctors how to, each medication should come with tapering instructions and a tapering mechanism. Here's like a taper pack, or here's a special, we don't give this to everybody, but here's like a, special graduated dosages or a liquid form. Same thing with addiction treatment with buprenorphine. You basically have really two dosages that are available for buprenorphine, because you can't get the 12 or the 4 milligram anywhere, but you have the 8 and the 2 milligram buprenorphine. And most people are almost nobody is ready to drop off at 2 milligrams. They need to taper far below that, and it just doesn't exist. And then the package says never cut or tear or break the medication. You have to take it intact. So they're basically saying never come off of it.
Yeah.
Um,
You're stuck.
yeah, and it almost does seem like some kind of medical terrorism. Like where's the tapering? Where's the teaching? Like a lot of doctors, I don't think know that tapering should be done with the like the SSRIs, like all the antidepressants. And it's like, okay, doctor, I've been taking Paxil and I feel a lot better. I'm done with it. What do I do? It's like, well, maybe take half the dose for a few days and you're probably done then. They just don't even know what to do with that. It's not in the instructions.
Yeah, it's scary. And so people who are considering taking this medication need to know that ahead of time. Like that's part of the informed consent. Like, hey,
Yeah.
depending on what you're on, by the way, it doesn't even come in the doses you might need to get yourself off. So you're going to have to figure that out. If you're on these, beaded ones, you may have to sit there with a little, thing and count out tiny little beads. This is going to be part of your life if you want to get off of this stuff. Like that's part of knowing the long plan for these drugs if you're going to initiate them. And I think a lot of people would not take them if they knew that was the
Yeah.
case. There is some hope though. I mean, I'm on the patient committee right now for, the FDA put out a black box for benzodiazepines a couple years ago. And one of the critiques of the black box is like, well, great. You've told everybody that there's physical dependence and that there's these horrible withdrawal syndromes and protracted withdrawal. Like, we're super grateful that that exists in the labeling now. But you basically just sort of generically said that people need to taper. Well, you didn't provide any guidance or information on how to actually do that. So they put up a bunch of grant money recently, and the American Society of Addiction Medicine is the recipient of that grant. And it is to come up with deprescribing guidelines for benzodiazepines. And they have a committee of patients who are working with the medical providers who are on the doctor side of things. And I'm on that committee along with a bunch of other benzo survivors. So far we've had one meeting and it's going well. And I think they're hearing us and really interested in having like a collaborative type relationship as the guidelines are developed. So we'll see how it goes. It's going to be a couple of years before they're out and we can see, what they are.
Yeah. What do you think of the Ashton method? It it does seem maybe it's dated, maybe there's better ways to do it, but I mean it is out there, and at least it's a good starting point to learn about it. What do you think about it?
Yeah, I mean, I love Heather Ashton. I think she was like the pioneer. But anytime, someone does it first, I think many, many years later, people have perfected it and come up with new techniques that can make it easier, and that kind of thing. So she really just like, gave us the idea and gave us the equivalences to Valium and that kind of thing, which is so important. But I think the patients went home, took that and said, okay, I'll do it better. And we have ways that we've developed, not everybody switches to Valium either. A lot of people don't like Valium. They don't think that they feel as good on Valium as they did on their original benzo. And so they just directly titrate off of, Klonopin or Xanax. So yeah, there's a bunch of ways to do it, but I think the Ashton Manual is a good start. Where people get in trouble is they try to follow it like a cookbook, like they think it's like a recipe that they do one step. And a lot of times it's the doctors.
Yeah.
They miss the paragraph where she said very loudly, this is only a guide. Let the patient adjust as needed. I mean, that's the biggest take home, is that the patient's body should dictate the rate and speed of taper, not some chart that you're following.
Yeah.
Yeah.
So now, as far as like as far as other things that might be helpful, somebody mentioned in an email, they said they had looked at my material and feel I'm not doing any biohacking, and I wasn't sure what they meant. Like what is biohacking exactly? Like I just imagine, there's these groups of people that are like trying to grow like, fresh vegetables and healthy meats, and they're doing all these like crazy things to maybe they're taking psychedelics, like or they're taking all kinds of supplements blended together. But I'm not. Have you heard of that, biohacking for benzo protracted withdrawal?
Okay, so in the like I'm a member in some of the primal paleo keto world, and I, follow that kind of stuff because I eat that way, and it makes a lot of sense to me, like looking at what our ancestors did and how we managed to evolve. And in that world, the biohacking stuff is like using blue light blocking glasses,
Oh yeah,
to before bed when you're on your screens, and to get yourself sort of in that sleep mode or whatever, because we're all exposed to all these lights and it messes our sleep up and that kind of thing. So I'm not sure
yeah.
if it goes beyond that. I don't
That's
know.
that's a good idea when you mention that. The
Yeah.
original blue blocker sunglasses, I love those. I mean, they just make the whole world look a lot happier and more peaceful. And the big downside is you can't really see green lights when you're driving. So you either have to like know what a green light, it's the absence of red basically. Um, but otherwise, yeah, that's a good idea. Blocking the blue light, or I guess some devices can filter out the blue for you. Um,
Yeah.
but yeah, in the diet. That's another good point. I think some people have told me that a low carb diet helps them, and I think it helps me too. I feel less anxiety if I'm eating low carb.
Yeah, I interviewed Chris Palmer recently. He's like the big keto psychiatrist out of Harvard. And yeah, I told him when I went on keto in benzo withdrawal, I knew there was something to it because I stopped biting my fingernails for the first time in my life when I was in ketosis, which I was like, interesting. So I must
Yeah.
be less anxious if I'm not doing that, you know?
Yeah. Yeah.
Yeah.
And I mean, I don't know if they still do it, but I know when I was a student, I saw when I did my pediatric rotation that they were using a ketogenic diet to treat seizures in children where they were resistant to other treatments. And so I was thinking like seizures are like the worst thing of, someone is in acute benzo withdrawal, they could have a seizure. So that's like that's like the thing you don't want, like that over excita, excitation. I can't even think. I'm gonna
Yeah.
cut that part out.
Yeah. Yeah.
Excitation, whatever. But
Hmm.
yeah, like the brain is overstimulated. And but yeah, so you don't want a seizure, but the opposite of that would be, you're on a keto diet, you're calm, you're
Yeah.
relaxed. Um,
Yeah.
so yeah, I can imagine it would be good, and sometimes I think I forget to bring that up with people, and definitely something I guess we should you probably have a list. Do you have a list of stuff that you go over when you talk to somebody, like to make sure you don't leave something out when you're doing like a consultation with someone or helping them, get through protracted withdrawal?
No, because I don't really do consultations. I mean, it's more just like, helping people out just from my experience or sharing my experience. But I always make sure to say like obviously what we already discussed is what worked for me, might not work for you, but you can certainly try it. It's like we have all these anecdotal tools that somebody before you has tried. And so you can post in the forums and ask, and you'll probably get a varied response. And then you just sort of have to make your own decision and decide, like, well, to me, going on a diet seemed like one of those low risk interventions where it was like, well, if it doesn't work, so what? But I might like lose a little bit of weight. And another good thing that I noticed with it was like the benzo belly type stuff that you were talking about really cleared up. Like I had a lot of GI issues and the keto diet really helped that. But I eat pretty clean keto. Like you can do junk food keto if you
Yeah,
wanted. They have all those products and, processed whatever now. And
yeah,
if you eat enough of that, erythritol or whatever, you'll be on the toilet all day long. So yeah,
yeah.
I eat like real food keto. So
When you say clean keto, what about like things like those little like sausages and beef jerky? I guess they have some organic ones that don't have stuff in them that are probably okay.
yeah, I don't buy the ones that are, preserved with nitrites or whatever and I mean, you can, if you get like gas station jerky, that can have like a lot of sugar in it if you don't read the ingredients. So I do get the ones that are, they don't have sugar. And I think they use like celery juice to preserve them or whatever. But it's nothing fancy. They have them at Trader Joe's, like Chomps is the brand that I get.
Yeah,
But they have other brands like Primal something or Nix Sticks is another one. So yeah, I eat
yeah,
those.
yeah. I
Yeah.
actually got the Chomps one. I think I got that at Costco, like a big pack of them, and they were really good.
Yeah.
So
Yeah.
okay, yeah, yeah. Oh, I wanted to ask you, have you tried ketamine infusions?
No, I
Okay.
haven't.
Yeah, that's something
Um,
some people have told me they tried it and it didn't help them, but then the proponents of it say that you need to do like a series of them, like six of them, and then some people get upset like, well, I didn't get therapy, and not all the places give therapy because the medication is supposed to have beneficial brain healing effects, with or without therapy. But
yeah.
yeah, I'm not really sure about that because I've heard people with other issues, other health, people with mental health issues or chronic pain that said that it was like the greatest thing ever for them. But I don't know if it really has any great benefit for protracted withdrawal.
Yeah, I haven't tried it. I probably never would. I mean, I told you at the beginning before we started recording, I'm kind of, and a lot of benzo people or psych drug withdrawal people are like this, they're kind of scared of sort of rocking the boat too much. Or,
Yeah,
I've also been to places in my mind from withdrawal that I didn't even know existed. And so when you start talking about things like more drugs that can make you have experiences, or like these people saying like, well, what about psychedelics? And it's like, I want to feel normal. I don't want to have, you know,
Yeah.
trips or, you know, that kind of thing. I'm good. After
Yeah.
being in psych drug withdrawal, like that just scares me. But at the same time, I could be just completely short-sighted because there are people who swear by psychedelics, and there's all this research and stuff there. I watched a podcast the other day and I was like, you know, like I don't want to slam the door on it if it could
Yeah.
help somebody. So I think just need to learn more, but for my own purposes, I probably would be too afraid, honestly.
Yeah. Yeah. Maybe it's more of the derealization effect of like takes you further from reality.
Yeah, and
Um,
I've been far enough that I don't I don't want to go further. So, yeah.
yeah. What do you think about I guess there's a therapy called acceptance, or is it acceptance and commitment therapy? And
Mhm.
it's a whole field where there's people trained in it, but it almost seems like common sense of like, that accept where you are, accept your life as it is, or learn to accept it. And then the commitment is a commitment to do positive act, take positive action. Um, but it does, I have talked to people that like are really in denial, I think, of like that now their life isn't what it used to be. Maybe, they're not the same. Like just for example, like I had a patient that went through COVID and he had a really bad reaction. I mean, it almost killed him. And then afterwards, for a long time, he had a lot of anxiety and depression and fatigue. And this is someone that was like a, highly successful, motivated person. I mean, he's still very successful in business, but he went through a period where he really just couldn't do anything. And I remember talking to him and he said, um, I'm having anxiety. I've never had anxiety in my life, and I'm tired. I can't get anything done. And while he's explaining in detail how he felt, I thought, oh, so now you're like me, because
Yeah.
that's how I feel all the time. But
Mhm.
I'm like, but that must be really hard for someone that's never felt that way to suddenly be confronted with that. Um, but do you see things like that? Like your life isn't what it used to be, but maybe you can learn to accept it as it is.
Yeah, I mean, I think you have to, if you're going to go through this process and you get like any level of disability from it, like what choice do you have? If you, like, for me, I was so sick on the drugs that the only sort of light at the end of the tunnel was that maybe I could get off of them and have a life again or health again. Staying on them just wasn't an option. I mean, I know for some people they feel fine on their drugs, and so maybe they would not even want to embark on trying to come off. But for me, it was like, I have to get off of this stuff or I'm not going to survive, you know? So I feel like I did have to radically accept. I mean, I think what I've seen is a trend sort of when the bad suffering starts and the losses start happening because you're so ill. The initial response is rage and sort of pushing back up against it, and, you know, like a temper tantrum, and, you know, just normal human, like, this isn't how I planned for my life to be, and this is so unfair. And, but that doesn't change anything, you know? And so eventually I think people just become sort of worn down by the process into acceptance. So they realize, like, I'm going to have to go through this if I want the end goal, which is being off of these medications. I remember in the beginning when I was sort of in that phase of rage and poor me, and this isn't fair, and all my friends are having this and this, and I've lost everything. My dad said to me, not everybody's guaranteed a good life. And when he said that, like, I hated him for it. I was pissed. I was like, rah, you know, like, what a stupid thing to say. But it's true. Like, I could have been in some terrible car accident. Like, it didn't have to be psych drug withdrawal. People suffer and lose things and go through stuff all the time where their health is not optimal, and, you know, it interrupts their life. And so this is just part of my journey, you know. And
Yeah.
good things have come out of it too. Like, I also hated the people who tried to, like, you know, sugarcoat and make everything like, oh, I'm grateful for benzo withdrawal. Like, you'll never hear me say that. Like, I am not grateful. That this was the worst hell and it didn't have to happen. But some good stuff has come out of it. Like I've met amazing people. I have experiences that I never would have had. I'm super interested in a topic that's sort of like my life's work now and passion, and doors have opened that, I never thought I'd be working for a documentary film. Like stuff comes of it. You know what I mean? So you just make the best of what you have, even though it still sucks that your health is not optimal and you've lost a lot.
Yeah. Yeah,
Yeah.
definitely. And that's always kind of a touchy thing, I think, pointing out to a patient, things could be worse. And, of course they look at me as like, well, things are really bad. So, easy for you to say that things
Yeah.
could be worse. But there's definitely some horrible things a person can go through. Like I know the one that always comes back to me is that ALS, Lou Gehrig's disease, where a person is like, and I feel terrible for anybody who listens to this who has that. I mean,
Yeah.
and I mean, being trapped in your own body and not being able to getting to a point where you're in there and you can't move or do anything. And, maybe you're on life support and your loved ones don't know what to do. And, um, and then you think about like how terrifying and claustrophobic that must be just to be there and not be able to move your limbs at all. And like, then, because I get claustrophobic just thinking of any enclosed space or not being able to move. But,
Yeah.
but yeah, I mean, at least, if someone going through this, they can they still, they haven't lost a limb and, they're able to move, they're able to do things and accomplish things. And I know that it's not what they would have been if it hadn't happened. And I know people are angry because they've been injured by the healthcare system that didn't know any better,
Yeah.
and should have known better. But yeah, I mean, I think there's always things to be grateful for.
Yeah. And I would say if you're supporting someone ever, not to tell them there's people who are worse. Like that's kind of annoying to hear because what you're going through is awful. You know what I mean? Like,
Yeah.
and nobody wants to hear that. Like, well, you could have third-degree burns all over your body, and that
Yeah.
would be terrible, but it's like I sort of came to that on my own as part of my acceptance journey, like
Yeah.
examining, like, all these people around me. Not everybody's having a great time. Not everybody's healthy. Like people have horrible things that they have to contend with in life. And so that was like sort of my own realization. And also the most important one was like, I wish when I was younger that I had had more guidance and, just knowledge about like how you get one body and one chance at this, like if we were younger and we were taught about like eating properly and like exercise and sleep and, but I don't know if you can get that lesson if you haven't had the suffering to sort of bring you to that place. I almost feel like humans are so stubborn. We have to sort of be taken to the brink of something before we're like, okay, I get it now. And we start doing the right thing. What do you think?
Yep. Oh, I totally agree.
Yeah.
Yeah, and that's good advice for me to not bring up, things could be worse for you, because you're right.
Yeah.
I think people figure it out on their own.
Yeah. I mean, if there's another way to say it, maybe, I don't know.
But I can't imagine someone going through that for years and years and having to live with that.
Yeah. And also not knowing when it's going to end or if it ever will. That's the scariest part too, is just the timeline of what, I mean, I know every person who's protracted thinks that what if they're like the exception? What if they damage their nervous system so badly that it doesn't ever get to the place where you connect with reality again, or you feel normal emotions, or you can sleep right, or, but everybody's just sort of hanging on with this blind faith like, well, it has improved from the first 5 years, so hopefully like the trajectory is in the right, we're moving in the right direction, and you just sort of have to hang on. There's no doctor that can tell you absolutely this is going to go away. Like you're lucky if you can find a doctor who believes that you're having it,
Yeah,
so yeah, that's also part of the torture. And the timeline, not just the symptoms. Like, yeah, everything you listed totally sucks. Being dissociated for 10 years sucks. But the timeline is what ruins your life. Like, give me the worst suffering ever for 2 years because I can bounce back from that pretty okay. Like, I haven't ruined everything in a 2-year period. But if you're unable to work for a decade and you haven't put money into your 401k and you didn't get married or have kids, or like, that's way more devastating to your life in the long run than,
Yeah.
you know what I mean?
Yeah, definitely. Almost sounds like being sent to prison for a long time, you know.
I've thought about it like that, but at least they can feel connected to, I mean, they're not dissociated, and they, can play cards and, you know,
Yeah.
a lot of people in severe benzo withdrawal just lay alone in bed, they can't stand to even be around other people, really. So, yeah, it's like prison. Yeah.
But uh but yeah, I think, it is important to have hope, and you know,
Yeah.
and I believe that, the human nervous system, the brain, can overcome anything, and it could be actually damaged in some diffuse way of, toxic reaction causing diffuse damage to maybe the receptors or the neurons at a microscopic level. But I think the brain can adjust and accommodate, and I'd like to believe there's hope for everybody at some point.
Yeah, same. I mean, I try to say to myself all the time, like, if people were suffering so horribly and they just never got back to life, like, they would be all over the internet. Like, I would know them, and
Yeah.
those people just, yes, there are people who are off 14 years that I'm aware of who are still suffering. But if you get much beyond that, like, they're not there.
Yeah.
So it's like, well, if they exist, where are they? Why
Yeah.
aren't they in the groups
And
like everybody else?
and
Yeah.
someone at 14 years, like, maybe someone other than yourself, they're not probably not as bad as they were in the beginning, like they've improved.
No. Yeah, they'll all say the trajectory is towards healing. So, yeah, anybody who's super long term is way better than they were in the beginning. It's just that they're still, suffering to the point where they're not back to life again. They aren't working full time. They aren't, having um, all the landmarks and stuff that their peers are having and that kind of stuff. But no, it's not like it was in the acute first, handful of years or whatever. So
Yeah.
I wanted to ask you, I interviewed you for the Medicating Normal YouTube channel, and somebody in the comments, I guess, sort of was unhappy that you said you hadn't seen protracted withdrawal that much in your clinic. And I'm wondering, have you seen more of it since we last talked, or?
I read those comments, and it's probably a good thing I didn't see them live. I didn't realize they were happening. Um,
Yeah.
but yeah, I did read them back, and yeah, and I didn't respond really, but I think I kind of took them all in and felt bad that I said things like that, or didn't respond to certain things that people are asking. But um, on one hand, I'm sometimes afraid to say things publicly of that might imply there's no hope.
Yeah.
Like, I like to think there's hope for everybody, but yeah, not. And I wasn't as aware of it at that point. I
Mhm.
think after that, in fact, it does seem like there's things in the protracted withdrawal and the benzo withdrawal uh, condition that I'm not aware of, and then I learn about it. And then as soon as I learn about it, it seems like everybody's talking about it.
Mhm.
Um, just like the histamine thing. Originally, I didn't understand it, and then I got to know it a lot better, learned what might work for it, and then suddenly it seemed like everybody in every forum is all talking about histamines, and they hadn't been before. Or maybe I probably just wasn't tuned into it. But yeah, I think I wasn't really tuned into protracted withdrawal so much at that point. And since then, yeah, it's definitely something I'm aware of and I'm seeing more. And I think at that point I was more seeing people early on, and really trying to give them hope. Like, you're gonna, if you're not completely better, you'll be dramatically improved by this point, and hopefully not giving them false hope, but hopefully at least giving them some hope, help them push forward. And I think some people were really motivated to do things and move forward. But yeah, maybe like since then I've developed a more realistic approach, and I'm definitely seeing more and becoming more aware of people that are going to be dealing with this on a much longer time scale.
Yeah. Well, to your defense, a lot of, like you said, people in this position are angry, and rightfully so, but
Yeah.
we sometimes take it out on people who are on our team, you know. Oh, he doesn't know everything he's supposed to know. It's like, well, the doctors are the ones who want to help us. They're learning, it takes time. I mean, this is complicated, and you have to really get in there and join the forums and talk to the patients and all that kind of stuff. It's like a huge learning process to
Yeah.
understand all of it. And also, protracted people, we don't, like, the ones I know anyways, a lot of us don't really go to the doctor because it's like, we've been doing this for so long that most of the times when we go to the doctor, they don't believe us, or they diagnose us with something stupid that we know that that's not what it was. So it's kind of like a waste of time or money. And also, we also know that there's like not a lot can be done. So that could
Yeah.
be why you're not seeing a lot of protracted people, because I mean, short of taking a medication or something like that, like, and a lot of them are like me, they don't want a drug.
Yeah.
So a lot of times we kind of just disappear and slip under the radar, and we're not going back to the doctor. And so they don't see that we exist, really.
Yeah. Yeah. I've seen that people going through two extremes. One is they go to a doctor that doesn't believe what they're going through, or they discount it, and that because the doctors also don't have a lot of time, and they rush them through a brief visit and nothing really happens, or they put them on the wrong thing. They put them on more psych drugs just to hopefully solve the problem quickly. And then the other extreme is the functional medicine doctor that does a million tests and diagnoses them with all kinds of crazy things that may or may not be real, puts them on a ton of supplements, and um, and it's hard to say, was that stuff really helpful? And now the person thinks they have all these other things wrong with them, um, and they're taking huge amounts of supplements and things that may or may not be useful, and doing all these labs that regular labs don't even do. So that's like the other extreme. But although I don't know, maybe we can learn from them. Maybe there's some real stuff in there. Um,
Yeah. Yeah, I don't know. I mean, it gets so expensive, and then it's just like, ugh, what?
yeah,
I did that. I went to a functional medicine doctor, and it's like, $200 for 45 minutes or something. And I came out with like a prescription of 10 diflucan for
yeah,
my, gut overgrowth or whatever. And I was like, I mean, where does this, I didn't know what to do with it. So
yeah,
again, most of the time you meet people who have been in protracted long enough, and they've kind of just given up on the medical system, and they're just dealing with it, passing time on their own, taking care of their body, just waiting. So
yeah,
yeah.
yeah. But yeah, don't. I would definitely say that the message should be don't give up hope. And keep trying, and don't discount the natural non-medication things. The going outside, taking a walk, the fresh air, the sound therapy, movement therapy, like you said, yoga, which would be a form of movement therapy.
Mhm.
And those things that seem like, oh yeah, yeah, they're not going to work, but they do work and they do help.
Yeah, and friends and purpose. I mean, and distraction. Those three things saved my life. Meeting people in the same boat as me that I could complain to, I could call anytime. They would answer my phone at 2 in the morning because they're probably awake too. They're in withdrawal. Distraction because I could get out of my head, and I could you know, make myself focus on something else for a little while, and feeling purposeful. I mean, there's nothing worse than just existing and having nothing to do, or not feeling like you're contributing in some way. So, however you can make those things happen while you're sort of, to use the jail analogy that we talked about before, serving your time in withdrawal, it'll help.
Yeah. Yeah. And
Yeah.
sometimes you reach a point where you're like, maybe they put you in a minimum security prison, and then you're out on parole. So,
Yes.
there's
Like when you can
progress.
start driving again, or like, yeah, maybe go to lunch with a friend that feels safe or something like that. Yeah, you start getting work release.
Yeah.
Yeah.
Yeah. So, yeah, that's a good analogy. So,
Yeah.
anyway, so yeah, Nicole Lamberson, thank you again. Thank you for joining me today.
Yeah, sure. Thanks for having me.